Folic acid helps prevent birth defects, but how much should be taken by women who are pregnant or thinking of becoming pregnant?
I know it's important, but I don't know how much.
I thought it was 3 milligrams, but I understand that it's 1.
I'm not sure how much they should take, but I do know you need to start before you get pregnant.
Marlo Taylor gave birth to Keelan about 2 years ago. She recalls her search for accurate information.
One of the questions I had in particular was about folic acid, how much I should take when, and what really would be best for me and the baby.
Most women know the role folic acid plays in preventing birth defects, but Dr. Christine Dursko, an obstetrician gynecologist at St. Michael's Hospital in Toronto, says they're not sure how much should be taken and when.
Folic acid has been shown to reduce birth defects, particularly spina bifida. That's the one that most women know about. For most of my patients, therefore, I recommend an amount of 0.4 to 1 milligram of folic acid be taken in addition to what they get in their diets.
The Society of Obstetricians and Gynecologists of Canada advises women to increase intake of folic acid 12 weeks prior to conception. This is because the baby's neural tube begins to develop in the 3rd week, when a woman may not even know she's pregnant. Women should continue the supplement for at least 4 to 6 weeks after their pregnancy or for the duration of time that they're breastfeeding.
I recommend to my patients who are planning to get pregnant that they start taking a prenatal vitamin supplement such as Materna, which contains 1 milligram of folic acid, at least 3 months before they start trying to get pregnant. There is a small group of women who have been identified as being high at risk for open neural tube defects, either because they have a family history of this or they've had a baby with spina bifida, perhaps patients who are epileptic on medication and patients who are diabetic on insulin, and a few others like that, who should speak to their family doctors or their care providers about whether or not they need a higher dose.
Dietitian Gina Sunderland says there are a number of foods that also optimize a woman's intake of folic acid.
Health Canada recommends that all women of childbearing age consume a healthy, balanced diet, including good sources of folic acid, such as dark green leafy vegetables, beans, peas, lentils, corn, and oranges. And you know, in spite of eating a very healthy diet and carefully selecting food choices, women are not able to consume enough folic acid to protect against neural tube defects. And that's why a prenatal multivitamin supplement is recommended.
If you have questions about folic acid and what's right for you, talk to your doctor. Martin Vanderwood reporting.